Hey, everybody. Welcome to The Art of Healing with your hosts, Dr. Judy Jasek of Animal Healing Arts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Hello, Matt. Happy to be here as always.
Yeah, this one's going to be a fun one because when we do testing and when we test nutrient densities in hundreds of pets, what we notice is calcium, there's calcium deficiency in the diet. And so, and we see that because we can look at the calcium markers of how much calcium is actually being absorbed at a cellular level, and knowing that it does take a few other nutrients besides that. But I had a conversation with somebody, contact me to help them out and kind of coach them through how to feed raw. And she goes, "Can my dog eat bone? I can't eat bone." So it's this show today is going to be all about, can my dog eat bone? So we know dogs chew on bones, but do they eat it?
Yes, dogs can eat bones. Okay, is that good?
Yeah, all right, done. We're done.
Show's over.
This is over. But, in some sort is even when I went and got my raw mix, and we get our raw food from the same place, when I talked to Dee Dee over there, she'll actually start adjusting calcium levels, AKA bone, in the actual product itself. And so the product I'm buying has anywhere from 12 to 15% bone content for Leo and Mr. Cha-Cha. And we've noticed them both to be extremely healthy. When I run a report, the calcium's right, everything's coming in the right levels and stuff like that. But what kind of things do you see if a dog is deficient in calcium?
Well, if they're deficient in calcium, they would have unhealthy bones. And, if they're not, the thing is, if they're not getting it in the body, getting it in the diet, then, the body is going to start to compensate. And so it's going to start to leach calcium out of the bones.
Okay.
So they need a certain amount in the bones for the bones to be healthy. But then if they're not getting enough, the body is going to be, looking for that calcium because it's a vital nutrient. Calcium, we think about calcium in strong bones, but it's also essential for muscle contraction. So think heart, heart is a muscle, basically.
Yeah.
It's a muscular pump. So if we don't have appropriate calcium levels, then our heart may not be functioning properly. But I think the other thing that's really key is these nutrients are, I think we get into a lot of trouble when we start to micromanage individual nutrients because they're meant to be ingested together with other synergistic nutrients. So we talk about not just calcium, but the calcium phosphorus ratio. So to have healthy bones is not just the calcium. You need the right amount of phosphorus, and you need the right amount of magnesium for those minerals to do their job appropriately and get integrated into the bone. I've heard these stories in people that go get the bone density test and say, oh, you got osteoporosis. And they put them on drugs like Fosamax, which increase the density of the bone, but the bones are not pliable. And I've heard these stories about elderly people, like getting up off the couch and breaking a femur, like big bone, because the bones, they increase the density. So it looks good on the bone scan, but those bones are brittle. And there's, even though bones are rigid, of course, that's our skeletal system. It's rigid.
Right.
There's still a bit of pliability, or we'd have, tons of broken bones. So when you feed whole food, which is, the main underlying premise of my dietary recommendations, we feed whole foods, and you feed something like ground bone. Well, like feeds like, essentially. So you're getting a balanced mineral supplement in that ground bone. And bones are absolutely fine if they're fed raw. I don't recommend feeding cooked bones because it changes the nutrients
Mhm.
in the bones, and they can get brittle. So the
Yep.
ground bone in these raw formulas, that's raw, should be fine. I do have a fair number of clients that will say, I started feeding these raw blends and my dog vomited up some bone.
Mm,
And it freaks people out. Like, oh my gosh, this bone, I can't feed my dog this bone.
right.
I think that's more of a sign that that digestive system needs some repair. So
Yep.
the dog should have a really high acid content in their stomach. This is normal.
Yes.
It's how they start to break down their food, is
Hmm.
they have a really low pH. They have a high hydrochloric acid
Hmm.
component. However, if dogs have eaten commercial foods like kibble for years, or a good part of their life, and they've been on multiple rounds of pharmaceuticals, whether it's antibiotics or pain meds or immunosuppressive medications for itchy skin, we've damaged that dog's ability to digest their food properly. And so I look at it like, it's not about the bone. My 5-pound
Right.
Chihuahua eats these blends, and I get
Yeah.
pictures from people. These bones are as big as my fingernail, and my dog threw it up. Like, my 5-pound Chihuahua is swallowing those same bones, and I
Yeah.
don't have a problem. But she's eaten raw her whole life,
Yeah.
so I think it creates, and it's one of the reasons I wanted to talk about this, because then people get scared of the raw. And I think it's really important to realize it is not that the food is bad or that there's anything wrong with feeding bone. It's that we have to work on correcting that dog's digestion, and then they'll be able to handle the bone.
Hmm. Yeah, absolutely. And that's a great point. And you had mentioned phosphorus and magnesium as well. So phosphorus are actually getting from the muscle meat. So that's the easy one we get to feed our dogs is, you're
Mhm.
feeding meat, you're feeding just, whether it is in that blend that we get is, beef and tripe, but it also contains bone and organ. But that bone content mixed with the meat creates that symbiotic relationship and keeps that body in homeostasis, which is that ideal health that we want. And so the one of the scary sides is just like you said, is if we're not feeding enough bone, in order for the heart to function properly, remember your animal doesn't care if it breaks a leg. Now, granted, it cares if it breaks its leg, but it's more interested in having its heart pump effectively and keeping the organs functioning effectively because that's what's going to keep it alive. And so the stories that I have heard with chihuahuas or other small dogs that jump up on a bed and then they jump down off the bed at a high distance. I mean, if you think about it, like if it was us, it would be us jumping off something as tall as we are, maybe even
Mhm.
twice the size of we are. And then we jump off of it, and these dogs that don't have enough calcium in their diet hit the ground and break a leg, or they have further damage caused to themselves because we are not feeding the appropriate amount of bone content within the diet. And so we look at it as it's just one of those things. And when we get a test back, if calcium is low, it raises up I want to say it's not critical level, but it definitely raises our awareness that we have where we want to contact the pet parent and let them know it's okay to eat bone, for your dog to eat bone. That's why, uncooked bone, like you had mentioned, for Leo, I will just throw an uncooked bone in the backyard and he'll gnaw on it, break it apart as best he can. It does scale his teeth a little bit and help clean his teeth up.
Mhm.
But really, with it, he is getting pieces of that bone because he'll take the edge and
Yeah. And
crunch it up.
certain like other products, like additions to the diet that are bone, would be things like chicken necks or
Yeah,
chicken backs. And yes,
yeah,
poultry bones are perfectly fine to eat, as long as they're raw. It's when they're cooked that they become brittle. And I have
yeah.
seen, dogs get into the garbage, go get we're almost to Thanksgiving, get the turkey carcass, and
Yep.
those bones can tear up the digestive tract when
Oh, yeah.
they're cooked. But when they're raw poultry bones, that's like the best joint supplement because they're very high in cartilage. So again, we're
Right.
giving the building blocks not only for healthy bones, but also for healthy joints.
Mhm.
Chicken feet. And this gets
Yeah.
to sounding a little bit bizarre for some people to be feeding these body parts, but you know what, we're sacrificing the animal anyway. And I feel that we're honoring that animal way more by using its whole body and not just throwing these, you know, parts away, because things like chicken feet can be very nutritious. And like you mentioned, they're the best thing for cleaning teeth, because when a dog crunches through that cartilage, it just scales off all of that tartar. And I think, you know, when it comes to whole food feeding too, I think it's really important to keep in mind that, you know, we're not micromanaging nutrients. So you can look at a bag of food, bag of commercial food, and that, so they, like say your average kibble, they process it to the degree that they've destroyed almost all of the nutritional value. And then they add in a vitamin and mineral supplement, basically just spray it on. And so on paper, that looks great, but these are all synthetics. You have no idea if these nutrients are even going to be utilized by your pet, and are they going to work synergistically, like we were talking about, to build healthy bones. Because I feel really strongly that a lot of these products, people feel comfortable when they see this whole big nutrient list on the label of pet foods, and they get nervous when that isn't there. But if those are all synthetics, you have no idea if your pet can even benefit from them. And like you said, Matt, you know, you're picking up on low calciums. And I think that can be why. And it's also, you know, people, you know, it's important to know how to appropriately balance a fresh food diet too. You can't just feed. I heard about one just horrible story once where it was a breeder, and her dog had puppies, and at 4 months of age, these dogs had nutritional rickets, which actually was a vitamin D deficiency, which is also linked to calcium. But basically, they and these are big dogs. These are Great Danes. And the puppies then as they're growing, and their bones are so weak that their legs get really crooked and very painful. It's actually very, very sad. But this breeder wanted to feed a raw diet. She was feeding hamburger and Tums to her dog, to the mom. So
that's terrible.
So no, I mean, honestly, she might have been better off on kibble, you know, where at least they're getting the vitamin and mineral supplement, you know.
But and when you look at puppies actually require more bone content or calcium, as they're growing and developing. As you had said, their bones are forming, so they need more. They're utilizing more of that composition inside of their bodies. And so, this is something that is easy to address and scary when somebody doesn't have the information that they need in order to know how to balance a diet, and really making sure that they are putting in the right amount of bone content. And so I've heard of individuals supplementing with eggshells. Is that viable, or is that also play under that bioavailability and the dog's just not utilizing it to its full potential?
Well, it wouldn't be my first choice. Bone would definitely be, you know, my first choice. But eggshells are going to have, you know, some calcium and some mineral content. And so as opposed to a, you know, completely synthetic, you know, mineral supplement, it would probably be, you know, a better choice. But, you know, again, I like to think back to, okay, like feeds like, and what's going to be the best thing to feed our pets' bones is going to be bones from another, you know, mammal, you know, basically is going to be the most nutritionally complete form. Now, I will say that, you know, I'll work with people and people get nervous about the bone content, or their dog vomited and they saw a piece of bone in it. I'd rather keep them on raw with eggshells than have them go back to kibble. So sometimes there's a balancing act there. And sometimes, you know, we'll do that and then work on improving the digestive health of the dog. And a lot of times that'll happen on its own. But, you know, if a dog's been on kibble and has not been, you know, producing like the proper amount of acid in their stomach, it takes a while for that to happen. That doesn't just happen overnight. It can take weeks, sometimes a couple of months for a dog's digestive tract to completely adapt to eating a raw diet.
Yep. Do you think that's due to them detoxifying to some degree because of all the toxins that are in kibble, not that they're eating raw, and as they're balancing back out, it's just their body finding that proper balance?
Oh yeah, absolutely. Because I think what happens when dogs are eating kibble, the body does adapt to it.
Mhm.
Okay, it's getting toxins. We've talked about glyphosate and the inflammatory
Mhm.
carbohydrates and the
Yeah.
overprocessing and the synthetic nutrients and all these
Mhm.
horrible things that are in kibble. And their bodies, just learn to adapt because they don't have a choice. But when you
Right.
remove those toxins and feed them a fresh food diet, and the body can finally say, wow, finally, I can
Right.
just get rid of all this crap. I mean, really, the body
Mhm.
can't keep up. If you're feeding a food that's toxic, twice a day, the body can't keep
Mhm.
up eliminating that. So it
Right.
starts just accumulating the toxins. But then when you stop feeding them and you give the body better nutrition and get it off of the toxins, and then the body can just kick all that stuff out, and it does. And you might see a flare up in itchy skin or some skin rashes or diarrhea. You will see some symptoms like that
Right.
through this detox. And so you have to work with this and sometimes
Mhm.
pick it apart and say, okay, or is it that this particular blend of foods is not the best for this dog, or is it
Right.
detoxing? But it's not the food making the dog sick. And that's, I
Mm.
think, a really, really important point to drive home is that, a lot of times people start their dog on raw, dog gets diarrhea, the food's bad.
Mhm.
And they'll be taking the food back because it's not
Right.
that the food's bad, it's that your dog's adapting to it. And it's a
Yep.
really important distinction, because I see a lot of people get nervous and then they just want to go back to kibble. And then a few years down the road, they're going to be treating, some
Mm.
way worse disease in their
Right.
dog, such as cancer, um, because they've been on this, inflammatory diet.
So let's talk about that situation real quick before we close up. Is let's say I'm feeding now a raw based diet. It's got bone, organ, and that muscle meat that it's required in there, and it's the right levels. But my dog's new to it, and I start feeding my dog this, and they start throwing up and they start having diarrhea. At what point should I be concerned before calling you?
Well, I think I always look at how the dog is acting. Like
Okay.
if they have diarrhea, vomiting, but they're still acting pretty good, they have
Mhm.
good energy, then I think you can ride it out. I usually say that if the dog is acting good, still drinking water, so staying hydrated, you can give it 72 hours. If it
Okay.
goes beyond 72 hours, then we might need to offers some more gut support.
Mm.
Sometimes I will go to like a dehydrated or freeze dried during the transition if the symptoms persist.
Yep.
Just because sometimes it's easier for some dogs to adapt to those products than to
Yep.
the straight raw, especially in older pets. So, I mean,
Yeah.
I really work at not going back to kibble, but
Mhm.
sometimes a dehydrated or freeze dried as an intermediate, or we add in a little extra digestive support. There's some
Mhm.
herbs that can help support digestion and
Okay.
help heal the gut, help heal leaky gut,
Mhm.
or sometimes adding in some pre or probiotics can help.
Yeah.
Sometimes changing the formula. I see some pets do better with a little bit of produce in the diet, not the high glycemic like potatoes
Right.
and things like that, but some greens, some blueberries,
Yeah.
some, just a little bit of vegetable fiber. I do
Yep.
find some individuals do a little bit better with that. So then we do that sort of
Mhm.
experimentation and find the formula that that works best for the pet. And
Yeah.
and sometimes that's just the road we need to go on, but the solution is never to go back to kibble.
Yeah. No,
Don't do
it's
that.
never to go back to kibble. Um, so no, and that's where I'm glad that you said that. That every dog is different, and I like how you phrase it as an experiment. is if you know you're feeding one, adding one vegetable matters. So for example, let's say you decide to add pumpkin, just add pumpkin that day. So you know that if the dog starts to vomit or reject it or itch or something happens and their demeanor changes, you can point right to the pumpkin and say, yep, it was the pumpkin that did it. And then slowly introduce other items that, you feel comfortable putting in their diet, from spinach to sardines to, other, supplements that you're going to put in. And that's something we always coach, is start slow. Don't just throw everything at it. And something that we see a lot that happens too is over supplementation. When we are micro managing the dog's diet to some degree, and we are putting in those singular elements. So let's say I feel that my dog is not getting enough calcium and I buy a calcium supplement, and now I'm giving that calcium supplement without first assessing whether or not the current diet that I've put them on is meeting that requirement. Because as we know, mineral levels is like Goldilocks. It's right in the middle. Not too high, not too low.
Mm-hmm.
And when you have ideal, it's just right in that middle. And so in there is really taking a look at it and saying, okay, do I feel comfortable with the amount of bone that I'm feeding my dog? And it should be somewhere between 10 to 15% of bone content, higher if it's a puppy. And when you're looking at all of that going into it, I don't think there is a reason, if you're meeting all of the other mineral requirements and you've done your homework and you've looked at it, had a conversation with Dr. Judy, had a conversation with us, and really said, yep, this is what we need to put in their diet. I think allowing it to come in, and instead of throwing everything at it in somewhat of like a panic mode of, they're low on iron or they're low on calcium, let's just give them more. That's easy. The hard part is being patient with it.
Right.
Knowing that you're setting up the right diet.
Yep, absolutely. And to get the diet balanced and to be feeding them whole food nutrition is always going to be the best thing for the pets, rather than supplementing. And then supplementation should be very, very targeted for what that specific individual needs. If they just are persistently low in a particular nutrient, then we can supplement that nutrient. But I see the same thing like you were saying, that sometimes, people just, it's so easy with the internet. You go on there and you Google what you think's going on with your pet. And then, pretty soon you're ordering another 5 or 6 different supplements. And I think we can do more harm than good for sure with over supplementation.
So really just staying consistent with a well-balanced diet. So for example, when we buy it from a company that balances all those levels. We know what percentage is in there. And I do not over supplement. I don't supplement at all for Leo and Mr. Cha-Cha. We just at most throw raw bone out in the backyard for Leo or Mr. Cha-Cha to chew on. And it's entertainment for them to some degree, and they're looking at it, it's chewing a bone, but also they're getting that little bit more calcium, but it's out of a whole food source. So I think their body's more easily adaptable and more easy to process it.
Now, the one thing I'll just throw out there in terms of things dogs chew on that I don't ever recommend is rawhide, because the rawhide, so this is a little bit divergent from bones, but along the line of what can you give your dog to chew on, things like the cartilage-based chew treats, in addition to the bone, but like your bully sticks or your tendons, your ears, things like that, are fine. Rawhide is the hide. It's the skin of the cow. And when that gets in the digestive tract, that doesn't break down. So, and I have seen problems with that because it gets into the stomach and it just gets, wet and slimy. And sometimes there's those knots on the end of the bone that the dogs can swallow. And those sometimes will block the digestive tract. They won't break those down. So that's the one thing just to avoid, along the lines of what is it safe to give your dog to chew on?
Yes. I'm so glad you said that. Yes. Don't ever buy rawhide. Allow rawhide to leave the industry. There's no reason why a dog should, or we should even sell rawhide anymore. And
Mhm.
so it's a little frightening that we still do. So thank you for mentioning that. So Dr. Judy, what is the best way for somebody to get a hold of you?
Well, my practice is Animal Healing Arts, and you can find me at ahavet.com. Our email is info@ahavet.com, and our phone is 720-515-2421.
Wonderful. And you can always reach out to us at ParsleyPet.com and order the nutritional blueprint. We can tell you at parts per billion what their calcium levels are, but I just don't want to see it in their blood. I want to see it in their cells. Are they absorbing the calcium?
Mhm.
Are they getting the right levels of phosphorus and magnesium to create good bone density and good bone structure? We can give you that answer with the nutritional blueprint. So I want to thank everybody for being on the show today. And thank you, Dr. Judy, for all of your wisdom. It is so appreciated.
Oh, it's my pleasure. I love to contribute to educating the pet parents out there.
Yeah, because it's every time we do it, I feel we help one dog get healthier, and that lifts our hearts. So thank you guys so much for being with us today and being on the show. So we'll see you later. See you guys next week.
Hey, bye
All
everybody.
right, bye.